A select few people are truly worthy of being called a household name. Oprah Winfrey, or simply Oprah, as she's better known, is one of those few. Many know Oprah from her daytime talk show, The Oprah Winfrey Show, which aired from 1986 to 2011. For 24 consecutive seasons, this show was America's #1 talk show, drawing in millions of viewers daily. Oprah discussed numerous topics on her show that many considered taboo, such as addiction. The Oprah Winfrey Show has many episodes dedicated to discussing its complexities. Given Oprah's extensive reach and somewhat invasive interview style, she likely exposed many of her viewers to the harsh truths of addiction for the first time. Though responsible for educating the masses on countless topics and simultaneously providing the inside scoop, she kept her own battle with addiction a secret for years. Years after her show aired, Oprah revealed that she'd also dealt with addiction for some time, like many of the people she'd interviewed. In a 2005 interview, Winfrey said that disclosing that she was addicted to crack cocaine in her 20s was one of the hardest secrets she'd ever had to share. However, this addiction didn't stop Oprah from becoming the billionaire media mogul she is today. Oprah is not alone in her experience with addiction. According to Judy Minkove at Johns Hopkins School of Medicine, substance abuse disorder affects over 20 million Americans aged 12 and older. We should note that there are noteworthy differences between substance abuse and addiction, though the terms may seem interchangeable. Individuals who abuse substances like drugs or alcohol still maintain a degree of control. Such abuse may stem from a need to cope with everyday stressors, but may resolve. On the other hand, those addicted to a substance don't have much of a decision. For them, their addiction is debilitating and infects their entire livelihood. They are chemically dependent on one or more substances and will likely experience withdrawal symptoms if they cease use. In the case of addiction, the choice to get sober can be the difference between life and death. This austerity is why addiction is considered a disease. Due to this, some may argue that addiction is more serious or important than substance abuse. However, we should remember that both conditions pose unique challenges. Furthermore, addiction can happen to anyone, as regular substance abuse makes addiction more likely. Though alcohol and illicit drugs are the most abused substances, people may also become dependent or addicted to caffeine or gambling, among other things. Signs that an individual may be struggling with substance abuse or addiction are changes in their behavior, weakening of formerly strong personal relationships, a neglected appearance, physical health issues, mental health issues, problems at school or work, and money issues, such as frequent requests to borrow money or selling their personal items. It is important to remember that many people may experience one or more of these symptoms for reasons other than substance abuse, like depression or a difficult life change. However, if you are concerned an individual is struggling with a substance abuse disorder, there are organizations and mental health providers who can help. The CDC estimates that substance abuse affects 1 in 7 Americans, making it a dangerous reality for more people than you may think. Given this prevalence, employers and coworkers must prepare for interactions with employees battling substance abuse or addiction. Many employers already have clear and concise drug-free policies, which is a great first step. Yet these policies don't stop individuals from abusing substances outside of work. Indeed, drug abuse in other areas of life is likely to affect one's workplace presence and productivity. Industry costs for substance abuse are estimated at over $100 billion each year. This figure includes absenteeism, productivity reduction, substance abuse-related accidents and healthcare expenditures, as well as criminal justice costs. Thus, a supportive workplace environment that doesn't encourage or contribute substance abuse is crucial. To this, employers and HR teams can conduct training sessions educating individuals about substance abuse issues. Likewise, supervisors and coworkers can call out hurtful language and work to eliminate it when they hear it from peers. For example, terms like junkie or druggie should be substituted with something more humane and factual. Employers and HR teams should be ready with helpful resources, like insurance-covered treatment options and external support groups, like Narcotics Anonymous or Alcoholics Anonymous chapters. For team members who may not struggle with substance abuse or addiction themselves, but have a loved one who does, employers can still provide support with open communication and education and resources like the group Al-Anon. Unfortunately, sometimes such assistance isn't enough, or employees may not be ready to get sober. In these cases, employers may have to part ways with such employees. When someone with substance abuse disorder feels supported at work, they can begin to shed some of the shame and guilt associated with their condition. Once this weight has diminished, they're more likely to ask for help. This approach shows that a company actively dedicates itself to acknowledging, employing, and supporting individuals struggling with substance abuse or addiction.